How many of you took an antibiotic and did not complete the treatment till the end? How many went and took an antibiotic off the counter without a doctor's prescription? A very serious issue is coming because of these things that you, the public, are doing. We're happy to have with us Dr. Rana Hajjeh, the Director of Communicable Diseases at EMRO, the regional office in Cairo. Welcome, Dr. Rana.
Thank you very much.
I started off. We're seeing a lot of cases of resistance to antibiotics that used to work very well. Why is this happening?
Yes, thank you very much for bringing attention to this important problem of antimicrobial resistance, or AMR as it's commonly referred to. Indeed, this is becoming a very serious public health problem for multiple reasons. As you know, antibiotics are currently being abused by everyone. Everybody, and not just by healthcare providers who prescribe antibiotics often for things that are not needed, like viral infections. If you have a common cold, you don't need an antibiotic. It's going to go away by getting some rest, some Panadol, fluids. So you don't need antibiotics. But also, it is important for the community to be aware that antibiotics are not needed, so that they don't put pressure on their physicians.
Here the media needs to play a role in raising the awareness.
Yes,
very
exactly,
important.
exactly.
So WHO is putting that on its agenda now, the antimicrobial resistance. We're seeing a lot of write-ups about it all over. Television is talking about it. So that's a start. In the region, are there any particular countries that are misusing antibiotics more than others?
Unfortunately, although I have to commend our countries on taking the problem of antimicrobial resistance seriously, the use and abuse of antibiotics is rampant
everywhere.
It's rampant. There are very few countries that I can mention in the region, I can think of offhand.
That are prudent, you mean?
That are prudent, not only prudent, that have enforced, for example, not giving antibiotics without prescriptions.
Will that require legislation?
That requires a policy. But this is not the problem, because in most of our countries, we do have policies. The problem is the policies are not enforced. You can go almost to any pharmacy in most of the countries in the region
and just
get almost any antibiotic, almost any, including the more potent antibiotics, which are really the last resort.
Which will lose their potency pretty soon. Exactly. It's misused again and again.
And we are going to get to a point, we are actually facing this in many situations already, where there are infections that we are not able to treat. And we have patients who are dying because of this. I think almost everyone I talk to can mention a relative or a friend who got into a hospital for a simple procedure, developed an infection that
lasted much longer than it should, or
and sometimes people was not cured, and some people passed away actually.
So we have to be
unfortunate.
very careful with that. If you're given your treatment, please continue till the end. Compliance is very important for people who are taking things regularly for a while. So we have to be very careful about that. Another topic that's also very important in this region, Dr. Rana, is the infection control. From experience and from seeing a lot of places, it shows that many countries in our region are not taking sufficient care for infection control. Even dentists, even everywhere. What do you suggest?
Yes.
What do you advise?
Yes, that's a very good point. Infection prevention and control, as we call it, is critical in this region, and we are unfortunately not doing very well. It's very important actually to link it even to the problem of antimicrobial resistance that we just discussed. This is how the resistant infections are spreading, whether it's actually in the hospitals or the healthcare settings or in the community, because of poor infection control, because of poor washing of
washing hands.
Simply hand hygienes. I mean, it's not that complicated. So simple infection control measures can really
make a big difference.
Make a huge difference.
And the simplest is the one you just mentioned. Simply wash your hands with soap and water regularly.
Hand hygiene. Every time you touch a patient, every time you touch even fomites in a hospital room, etc., you have to wash hands. But there are, of course, many other measures for infection control. The other reason infection control is very relevant for our region, because this is really how also some serious infections, in addition to the antibiotic resistant ones, are being transmitted. Hepatitis, HIV, other infections that are what we call bloodborne, that are transmitted via bloodborne or sexual contact. These are all very important to have good infection control. And actually, just in Pakistan now, we launched the National Hepatitis Strategy, which is really a very important step taken by the Ministry of Health of Pakistan to promote prevention and treatment of hepatitis. And prevention, the main ways we prevent hepatitis is by infection control and by vaccines.
So what you just said is that Egypt and Pakistan, the two alone, form 80% of the cases of hepatitis in the world.
Of hepatitis C.
C, and
yes.
that's a very, very important point, and they're both in our region. So this launch was something historical in a way. And Egypt has made great strides by giving 1 million.
Yeah, they have treated, Egypt has treated over 1 million patients now for hepatitis C, which is really a great achievement.
And you mentioned AIDS as well. AIDS is a topic that people try not to talk about. They try to put their head beneath. Are you trying as well to make this come on top so that people can be treated? Yes. Because now there is treatment for AIDS.
Yes, of course. HIV/AIDS is still, unfortunately, a topic, a taboo, a topic of big stigma in our region. However, it's important to know that HIV/AIDS is preventable, and HIV/AIDS is treatable right now. We are not at the point of curing it yet, but it is treatable to the point that people are surviving for years.
They're even having children, I hear.
Of course, yeah.
They can,
yeah,
so I mean, they lead a very normal life.
Again, I mean, with HIV/AIDS, in our region, most of the populations affected can avoid it by better prevention, whether it's better prevention through prevention, of any exposures to unprotected sex, or prevention also by providing injection safety, because whether it's IV drug use or even other exposures in healthcare settings, we can prevent it by having better infection control.
Thank you very much,
and
Dr. Rana.
Treatment, of course, is really critical.
Thank you.
It's great.
And once more, the message to take home on infection control, the simplest measure, there are lots of things, but just wash your hands with soap and water. And on antimicrobial resistance, please listen to your doctor.